Hello, this is Dr. Jeffrey DeSarbo again. I'm a psychiatrist and specialist in the treatment of eating disorders, and I want to welcome those of you who have seen the first episodes of this NeuroSeries to NeuroSeries number 4 on children and adolescents. Again, I want to just give everyone a reminder that all I'm presenting here is a very, very small sampling of the information that's out there. But again, want to lay that foundation for everyone that there is a biological basis to somebody having and developing an eating disorder. So let's get started right away. Basically here, you see that this is how a brain develops in all of us. And we were all children once, but we don't really remember being kids and how we process the world. We can remember things that happen, but I always go through this with all the therapists I work with and patients and families so that they can have a good understanding of how the brain develops. And depending on where an eating disorder starts or where they are age-wise, developmentally, and they have an eating disorder, how it's affecting the brain, it's important to understand this brief little chart here. You can see in the yellow area, that's called the brainstem area. When someone is born, they're born with about 200 billion neurons, and during the first year of life, they lose about half of them. It's kind of a use it or lose it philosophy. We keep what we need, we kind of get rid of and discard what we don't need, and then those neurons start to wire together, and they form networks, and it kind of determines how we think of and process the world around us. So the first part in birth to 1 year, again, is that brainstem development. It's very basic wiring, but that's the region under high, I call it like high-speed construction. So the brainstem is responsible for very basic things. If you think of an infant, essentially in their first year of life, things like balance and coordination and reflexes, that's what's starting to wire big time, okay? And then, of course, as the infant gets older, things like coordination with learning to walk, learning how to talk, those are things that start to kind of expand outside of the brainstem. Second year of life is really where the limbic system starts to develop. And so basically from like year 1 or 2 through about early teenage years, that pink area that's noted on this slide is where the limbic system is. That's in the kind of like the inside part of the brain. And this is under high-speed construction. And the limbic system is thought of often as our emotional brain. It's where we react to things. A child's world is an emotional world. If they see a red bicycle and they want it, all they know is they want that bicycle. And as adults, we'll sometimes ask them to delay gratification and, well, save up or get some stars on your chart for, doing your room or things like that. But those are processes that usually take place in the kind of the bluish-green regions here of the cortex, the frontal and prefrontal cortex, which goes under high construction more from like early teenage years to about the mid-20s. And that's our executive functioning and processing, where we can, as adults, be able to rationalize things, put things in perspective, delay gratification, think more in abstract manners. And then the frontal prefrontal regions have feedback systems to like our emotional brain, so it helps us talk to ourselves and kind of like calm ourselves down. But this is important for eating disorders because with children and adolescents, there's changes that take place in these regions that can have long-term effects on development. So I always want people to kind of have a rough idea how the brain develops, at what point in life are they. This also has implications for how one conducts therapy sessions with somebody who's, let's say, is 10 years old versus 14 years old versus 24 years old versus 44 years old. Different type of therapeutic techniques are often required because of where the brain is in its developmental stage. Now, eating disorders often can lead to these changes early on in life, when they come on in children and adolescents, and they can cause significant changes to the brain. The region known as the superior temporal gyrus is one region that has decreased volume compared to those who don't have eating disorders. And this correlates to changes in eating disorder cognitions related to weight, food, eating, body shape, and kind of processing thoughts and making them kind of like a scary thought to children and adolescents and teenagers, because part of that region, and it's not included here, but you'll see it down the road, is the amygdala, kind of like our fear centers and everything, which is part of that limbic system. And again, so for an eating disorder for a child and adolescent is a much more an emotional experience. Even though it is for adults, for a child, it's almost purely an emotional and behavioral experience. In this study, too, the insula, you can see, is the region right there circled. And there's a decreased volume with adolescents compared to those who don't have eating disorders. And kids with eating disorders, they have problems because of this with working memory reaction times. And it's important, like from this slide, to understand that getting treatment early before long-term structural effects and behaviors occur is really a priority. This is a slide that I think I had in the last episode of the NeuroSeries number 3. The effects of eating disorders on young people essentially can be substantially more impactful. As you can see, gray matter and white matter regions of the brain. The gray matter is, kind of the outside of the brain, all those folds you see and everything. And the white matter, which is kind of what's pictured here on this slide, are tracks that kind of connect the different brain regions and connect with each other. And you can see the amount of volume loss to these types of regions is significantly greater at times in children than it even is in adults. And because the adult brain is more developed, for a child, you're not always sure what the implications down the road are going to be. So with the brain, there's significant changes that can take place with the cognitive development with adolescents. And in this study, they actually looked at a cross-section of a whole bunch of different studies to see what's kind of common and how the brain changes. And they find there's changes in networks that impair cognitive flexibility, leading to this rigid thinking patterns that are often seen with eating disorders. Memory's impaired, the neuronal networks are slowed down, which can definitely affect how one's ability to pick up on social cues and others who are around them with empathy. Can they kind of pick up on how one's feeling and kind of understand how they're feeling? That gets impaired. Social anxiety can develop, and that fear that others are judging them starts to occur. Then they're highly sensitive to words, behaviors, and actions of their friends, their peers, teachers, adults, and often feeling they're judged all the time. Remember also, like with these impairments, that eating in most cultures, including here in North America, is a major source of social development and social interaction with others. So when the brain impairments lead to these types of deficits, both children and adolescents and teenagers can have changes in their psychological development, their personal relationship development, and they're all things like that are severely impacted. In this study here with neural activation, we see areas that may be impacted also during childhood development that reflect struggles beginning with body image and self-evaluation. And these regions right here, the activity changes that take place, it correlates to the kind of like how one feels about themselves. So this is a crucial period for developing self-esteem and confidence. And when changes that they find that are present with people with anorexia nervosa take place in the brain, they impact that developmental process. So one usually feels horrible about who they are. And when you talk with someone with an eating disorder, part of the eating disorder, again, it makes it different from disordered eating, is that internal self-talk of self-hatred and loathing and feeling they do not deserve certain things and they're not a good person. And that's not just something that's a psychological result of what they're going through, but it's kind of being correlated with the brain and how that has been changing during the course of the eating disorder as well. Bullying is known to have an impact, and here, kind of like the picture shows bullying in a schoolyard and everything, but we do know, too, that there's a lot of bullying that takes place in social media. In the first study here, it's a Canadian study of like over 650 students. It shows the correlates that are associated with the development of an eating disorder and childhood bullying and the intensity and frequency of it. Multiple studies on childhood trauma also clearly point to the development of an eating disorder. If you remember in one of the earlier episodes, we discussed epigenetics. So we're kind of talking things here that kind of trigger that eating disorder. There's the trauma itself and things like bullying can cause these actual changes to the brain where they measure changes in different parts of the brain's the cortex, that outer thing, the thickness kind of changes. In some people, there's increased thickness in certain areas and decreased thickness in other areas compared to people who haven't gone through these types of traumas and then have an eating disorder. Like I said, bullying can also take place through social media, and these days it's something that also people don't see, whereas many people might see actual physical bullying being picked on in a school setting or something like that. Young people who are on the computer and have tremendous screen time with social media often find very low self-esteem issues as well, and oftentimes they're feeling that they're bullied, again, that increased sensitivity, whether they actually are being bullied or that's their interpretation of something that's going on. So here we see that there's changes itself with the brain that takes place. The nucleus accumbens, that area that's circled there on the brain, is involved with the reward system. And every time somebody gets a like or a video goes viral, that part of the region of the brain starts to really fire off. And there's actually changes to the gray matter of the nucleus accumbens, the size of it that takes place. And this can lead to significant trauma and perpetuate eating disorders. Just as an example, I had a patient who was a young girl in her 13, 14, and had a video go viral that she posted, over 200,000 hits. And this made her feel really great. She was struggling with an eating disorder, and this video went viral, made her great. And her drive, because of that reward system and the circuitry in the frontal parts of the brain, the nucleus accumbens, had her spending about 8 hours a day trying to make her next video go viral, and none of them were going viral. So the interpretation, of course, is that people don't like me anymore. I don't understand what I'm doing wrong. And it's something that became obsessive. And her obsessiveness with the social media correlated to the increased severity of her eating disorder as well. So social media, and we hear a lot of negative things about it, and most of them are probably true, but it's really not a good thing when one is struggling with an eating disorder, especially. This is an update on medical consequences of anorexia, this study here. There's, of course, changes to both the brain, the heart, bones, every system, as I also discussed previously, takes place. And so the thing, again, is when we're talking about children, adolescents, and teenagers, you want to kind of get involved in that treatment as soon as you can, because oftentimes we find more irreversible changes that take place in children and adolescents than we do in adults who develop an eating disorder later in life. Again, the brain and the body are kind of the two things that are kind of developing at an early age. And then as an adult, they're mostly developed. And we're going to discuss the medical consequences later on in a future NeuroSeries. But this is just one example of a study that shows how there are certain things with the heart that kind of start to show dysfunction. It's related to one of the main nerves that innervates the heart. That's called the vagal nerve. And there's changes in the firing of this nerve that causes changes in how the heart kind of pumps, its rate and its intensity of being able to pump out enough blood. And with weight restoration in these studies, it's saying, well, in female adolescents that have had anorexia, there's many cases that it's not resolving itself. So I'm usually telling people with early intervention and everything, most things go back to baseline, both with the brain and the central nervous system, most of the time with medical issues as well. But the earlier one develops it, there are increased risks for some of these findings to be irreversible. So I'd like to welcome everyone to continue on our next episode, NeuroSeries 5, on the neurobiology of binge eating, which will be followed by the next 2 episodes on bulimia nervosa and anorexia nervosa, and down the line some more interesting neuroscience, neurobiology. Again, remember, this is just a brief overview, and if anybody wants more information, not only continue with the NeuroSeries and watch all the episodes, but feel free to contact us.